Hi, Meg. Can you hear me?
Yeah, I can hear you. Can you hear me?
I'm well. How are you? Yes, I can. How was your
Good.
Thanksgiving?
It was pretty good. And it's yeah, and I spent the last week and a half doing Julia from Middletown Schools on remote. Her teacher was remote. It was very interesting. So,
Okay.
yep. And I feel like we were much more successful on week 14 than on week 1. So that was good.
You hit your groove then, right?
Well, we did, and she did, and the technology use got better by everybody. So
Now, are they, I'm not sure the grade level, but is it Google Classroom, Seesaw, or Google Meets, or what are they using?
Google Classroom.
Okay.
And the teacher was remote, and she had a sub with the 3 kids who were in school because everybody else was quarantining, including my granddaughter. She was at the Y, and the Y closed the program for 2 weeks. So it kicked her back over to my house. So it was good. I mean, it was a good learning experience for me, and I have nothing but admiration for parents and teachers after 7 days of distance learning. It's just amazing.
Yeah. Yep.
So no, it is. It's good. The only thing that skewed her was that after Thanksgiving they had 3 half days, and there is very little structure, as much structure as you can put into a half day. So that was a little crazy. But other than that, it was good. And how about you? Was your holiday good? Yeah.
I didn't do anything. I mean,
Well, I didn't either.
just stayed home. You know what though? Usually, I always have big family, and I didn't have any this year, but it was kind of nice. I mean,
Yeah,
it was
it is.
relaxing. Read a good book, and
I know. I read 3 books over that weekend because I was all by myself. I just had the cat and the dog. So, but it was good. I cooked the turkey, and I didn't even eat the turkey. I ate all the vegetables. So it was good.
just need to go higher.
What are all these placeholders, just out of curiosity?
We're having a little trouble in the studio tonight. The
Okay.
cameras aren't on, so we're trying something a little different. But we're having a little issue with the internet, but it looks like
Okay.
it's working okay.
All right, I'll keep my fingers crossed. I am going to be taking the minutes tonight. Nancy is not available.
Okay.
So I'm the secretary.
Lauren.
Hi, Sharon. Hi,
Hello.
Justin.
Hi, Justin.
Sharon, I heard from somebody today that they have jury duty on Monday. Are there still live juries doing their thing, or is
No,
that crazy to
no.
me? Like, I thought that was a little shocking.
All jury duty was canceled till I believe the first of the year. If you go on the state of Connecticut judicial website, it says it right there on the first page. I believe it's all through through January.
So
Hi,
they're
Chris.
not doing juries by Zoom or anything, or
Good evening,
No,
Chris.
no.
well, that's good to know. I'm sure that the person I'm thinking of will be delighted to hear that, to go through the what ear process and all that, right?
Oh,
Yep.
that would be tremendous if they had jury duty via Zoom.
I got picked for a jury once, and it was a time in my life where I was like, oh, that's kind of cool. I get to be on a jury. I was hoping it would be something really interesting, and so they brought us in, and I'm on the jury, and it was a guy who slipped in front of his condo and was suing his condo association. I was like, oh man, I couldn't have got a good one. Like, give me a good case or something. It was the most boring 3 days of listening to about how he could only move his arm like this much now, and 70%.
That is the great majority of jury trials these days.
Yeah.
Very few, at least in Middlesex County, there aren't a lot of criminal trials.
Right. I learned a lot about rotator cuff movement.
Oh,
That was my
please.
takeaway.
I tore mine.
Yeah.
I could tell you stories, and they're not pleasant ones. It hurt
No.
a lot. So
Painful.
I had calcific tendonitis. It was pretty brutal of the rotator cuff. Do not recommend that.
So Sharon, I spoke with Tim today. He sounded okay. Sounded a little tired. He mentioned that he was going to try to get on tonight, but that don't count on him necessarily.
Yep. Yeah, he had texted me, didn't think he was going to make it, so we won't wait for him.
Okay.
I think everybody else is here. 1, 2, 3, 4, 5, 6. Yes, okay. So I will call the meeting to order. It's 7 o'clock. We'll start with the Pledge of Allegiance. If you'd all join. Pledge allegiance to
Allegiance to the flag of the United States of America
and
and
to the republic
for which it stands, one nation,
under God,
God,
indivisible, with liberty and justice for all.
for all.
Okay, is there a motion to approve the agenda?
I'll make a motion to approve the agenda. Meg
Okay,
Scata.
Laurel, second.
Second.
All in favor?
Aye.
Okay. School reopening update. Dr. Britton, we turn to you.
Okay, thank you. So I just want to, if anybody at any time has any trouble with this meeting, let me know. The tech folks up here are having a little trouble with it. I think we ironed out some of the kinks here, but it appears to be working now. But just stop me at any time if, you know, something goes wrong. Otherwise, I think we'll be okay. Alrighty, so you know, as I get started here tonight, I would say and remind everybody of the old saying that it is darkest before the dawn. Well, this is the moment, right? I think honestly, when future historians write about what we're living through right now, they will probably look at December 10th as our day that will live in infamy, right? I mean, it's right now. I mean, I think that we all have to kind of buckle up and recognize where we are, and here's the moment where it's the hardest, right? I think that we see that in the national numbers, what's happening in our state, and it's what's happening in Portland. So this is the dark before the dawn moment. I guess I'm hopeful that the aurora borealis that many of us can see tonight is a sign that the light is coming and that we're getting rid of 2020 shortly. But buckle up a little bit tonight. I don't have a lot of really good news to share, but I'm going to try to share with you everything I know and how I see the hand we've been dealt at this point. So let me start with the numbers. I literally received this data that I'm going to share with you from Russ Melman at the Chatham Health District not 45 minutes ago. I mean, this is as up to date as it gets. So for our Chatham Health District, all of our Chatham Health District towns are in the red alert level. Real quickly, I'll run through them with you. Chatham Health, 36.8 per 100,000 new infections over the past 2-week period. East Hampton, 33.9. Marlborough, 21.3. East Haddam, 23.0. Hebron, 39.9. And I'm glad you're all sitting down. Portland is at 48.4. So Portland's getting beat up pretty good right now in terms of new infections in our community. We started this year thinking that 25 per 100,000 would be the place where we would need to start to be concerned. As of tonight, we're at 48.4. So like I said, dark before the dawn moment here.
Hey, Charles.
Yes.
What was the time frame? I think I missed that. Was
The past 2 weeks.
Past 2 weeks, thank you.
Yeah, 14-day average.
14-day average.
Yeah. Middlesex County stands at 39.9. We also have to consider Hartford County because we have Portland students who reside in Hartford. That's at 54.3. And the state of Connecticut is at 53 per 100,000 new infections. So, yeah, I think that, you know, we are seeing what we're hearing about. And it's, you know, I think it is what it is. I spoke with Russ and I asked him, you know, does he think that we're at the peak right now? And I thought it was interesting when he thoughtfully said he thinks the peak is either this week, next week, or the week after, right? He thinks we're close, right? That we should see those numbers start to, the curves start to bend the other way. But literally, that's what I mean when I say I think future historians may well look at, you know, December 10th as the day when we were at the roughest moment. I think that's his feeling. I know there's no way to tell that for sure, but that's where we are. So those are the statistics. That's the quantitative data. Now, I want to remind everybody, some people would hear that and say, well, that's, you know, alarming. It's obviously not safe to be in school, right? Keep schools safe. The numbers are too remote. The numbers are too high. It's not safe. That right now is not why we're in remote. The Department of Public Health continues to hold the position that it is safe, and safe is a interesting word, but it is their position that schools could be open for in-person teaching and learning, even though those numbers are as high as they are. Based on all of the conversations I've had with Department of Public Health officials, I think if they had a redo from the summer on that 25 number, they likely would have not put it out there or had it much higher. But they were kind of playing it by ear in August, and that's where they started with that number. But more importantly, now they're asking us to examine the effect of the high numbers on our operating conditions, right? And generally, the Department of Public Health is reporting that across the state, we are not seeing widespread transmission of COVID in our schools, that there aren't large-scale outbreaks or transmission of COVID in schools. It's still there. It's not happening. It's just happening at smaller rates than in the community. And that, of course, I think is a tribute to the efficacy of our mitigation strategies. So even though the numbers are where they are, it is still the position of the people who are experts in this area that schools are safe enough to be reopened, right? I can tell you for sure that many people have an opinion about that position. But look, I think we have to accept that. We have to recognize it. We aren't MDs, we aren't RNs, we aren't masters of public health people, we aren't epidemiologists. I think at this point we have to defer to the expert opinion of the people at the Department of Public Health and take them at their word when they say schools could reopen in person, and they see that as okay, even with the numbers where they are. So let me just stop there and let that sink in a little bit and see if there are any questions at this point.
Charles, I am wondering, when you say Russ is, and I know it's just his estimation, and I'm not like going to hold him to the word of when he believes the peak is, but is he talking about he believes the peak to be here in Portland, in the state, in the country? Is he being any more specific on, or do you know why, the reasons why he's thinking the peak is coming soon?
I would have to ask him. I don't want to put words in. I'm always very careful about how I represent Russ's, and I fact checked everything I don't want to fact check him too much on that. I would say when he says that, he's talking about the state of Connecticut.
Okay.
That's my guess, but I could take that back to him, and I will do that, and I'll let you know what he says in my Friday email to you.
Yeah. Okay, sounds good.
Yeah, but I think that we're still according to Russ, we're still on the bad side of the curve, but we're getting there, and we all want to be is on the downside or really the bottom, right? I think we just have to sort of gird ourselves for the next 2 weeks, buckle up, and then hopefully with the vaccine and we're gonna start to see things bend the way we want it to, which is reductions in transmission rates.
So on the issue of the vaccine, is the district planning to have that widely available to staff or anyone in the next 2 or 3 months? I mean, it's going to be a little bit longer than that, isn't it, before it's available?
All I could say is the only information I'm getting at this point is from news media, right? And I don't put as much stock in that these days. I think a lot of people are guessing. I've seen no official word from governor's office or commissioners or State Department or state board. Nobody's given me any indication, except that I did get from Russ a request for the number of certified and non-certified employees in the town of Portland, both the municipal side and the Board of Ed side. So I have provided him that, and I asked him why he's asking for that information. And he is looking for that information because local health directors are gathering it because they're tiering out who's first in line. And I don't know whether it would be first, second, or third, but I suspect that teachers, municipal employees probably come a little bit after police, fire, nurses, but we would also be maybe a little bit higher than other groups of people too. All speculation though.
Mhm.
It is all speculation.
Okay. Any other
Okay.
questions on what we've heard so far? No? Okay.
Okay, so I spoke with Russ again today, and I asked him again that same question I asked him last time we were together, which was, Russ, it, based on this 48.4 per 100,000 new infections, if we were to reopen again in person, could we expect that COVID positive individuals would enter our school buildings? Whether those are faculty, staff, bus drivers, administrators, students, could we expect that? You know, and Russ is a nice guy, but he kind of giggled and said, yes, definitely, Charles, you can expect that. That is, it is not a matter of if somebody will when the numbers are this high in the community, would come into school. It is more a question of when and how many, right? At this point, if you fully reopen, expect that people who are positive and positive, either asymptomatic or pre-symptomatic, are going to come into your school. That is something you can expect. You know, no magic ball, no way to say for sure, but where the numbers are, that's what he said. That matches my experience this week. This week we stood up a daycare at Gildersleeve, right? Right now, we couldn't get through a week. There are 17 students in that daycare quarantined, 3 faculty quarantined because 2 students were positive in that daycare. So you know, that's what's going to happen when we reopen, is that positive people are going to come into our schools. I think that is both my lived experience and what Russ will tell us as a matter of course when numbers are at 48.4 in your community. So that, of course, led to my second question for Russ, which is that, is it still going to be the expectation that when a positive individual comes into schools, our nurses and the health department conduct an investigation, and anybody who is within 6 feet of the infected individual for more than 15 minutes is then expected to quarantine themselves, isolate themselves for 14 days? His answer to that was yes, that is still the expectation. That if you are within 6 feet of somebody, which is pretty normal in the classroom, even when you're social distancing and cohorting, for more than 15 minutes, even if you have masks on and are doing all of the other mitigation strategies, you will be expected to quarantine.
Hey, Charles,
Yep.
hasn't the quarantine guidance been reduced to 7 to 10 days?
Yes. The federal CDC, Centers for Disease Control, amended the guidelines so that at the federal level, it's 7 days with a negative test or 10 days without symptoms. The Connecticut State Department of Public Health is still reviewing those. As of today, it's still Connecticut's position that it's 14 days.
Okay.
I anticipate, if not tomorrow, then next week, they will revise, I think it's addendum 4, that it may reflect that change in length of time. But as of today, I spoke with Russ, it is still 14 days today, and no formal changes have been announced yet, though they're likely coming soon.
Okay.
All right. So what does that mean? Right? So let's just kind of back up a little bit. In the red zone, 48.4 per 100,000, we can anticipate that positive individuals will be in our schools. It's really only a question of how often and how many, and that anybody who's within 6 feet of that individual for more than 15 minutes at this point is subject to the 14-day quarantine that may be reduced to 7 or 10 accordingly, but that's the reality that we will face if I were to suggest tonight that we are going to reopen on Monday fully. That's what we'll have to absorb, right? Everybody's, am I lining up the dots on this one for you so far?
Yeah.
Okay. All right. So what does that mean? here's the hard part. If that happens, when we fully reopen, we must be prepared and able to absorb the effect of large numbers of students and faculty and staff either sick or quarantining, right? We have to be prepared for that. And again, this isn't theoretical. This is our lived experience from 2 weeks ago when one kindergarten, 2 second grade class, the entire 6th grade and the high school was put in this situation where we were quarantining large numbers of faculty, staff, and students. If we fully reopen, even though schools are safe, according to the DPH, that's what we have to be prepared to absorb. The reason we're not prepared to absorb that right now is because I simply do not have the substitute teachers ready to step in when 15 teachers across the district are quarantined. Right now, I'll give you an example. We opened the daycare last week. The entire Portland Public Schools was remote. No other schools were asking for substitute teachers. I called the ESS, our substitute service, and asked for one single sub to help us out while the YMCA was getting their act together with our daycare. I wanted one sub from ESS. They were unable to provide it for me. Not a single sub they couldn't get for me. I was shocked. And I got a little heated, frankly. I calmed down, but I talked about it. Like, you're kidding me, Beth. I can't get, nobody else is asking you for one. I'm asking you for one sub for the whole district. And crickets, nothing. So the reality is that if we're to absorb the effects of contact tracing and quarantine, I'm going to need way more than one sub. I project I'll need at least 20 to 25 district-wide on call, ready to go, and I have 0. So something else changed. Last Friday, the Governor Lamont, signed an executive order that waived the requirement that substitute teachers hold a bachelor's degree. Okay. Now, to be a substitute teacher, 18 years of age, passing a criminal FBI, DCF state background check, and preferably some experience working with children, preferably, that's not required, to be a substitute teacher. Last weekend, I put out the plea to the entire community. You may have seen my email, I'm sure you did, that I said, please come forward, community, if you're able to help me out in these very challenging times. Even if you don't have a bachelor's degree, let me know. I am blown away with the response from our community, particularly from previous Portland High School graduates. Remarkable. I've probably had close to 75 people raise their hands and say, Charles, I want to help. And I think that many of those individuals are motivated by a sense of wanting to help and community spirit, and less I want to be a sub, right? So all week this week, I have been interviewing some remarkable people who, out of a sense of community spirit, have raised their hands and said, I'm in. I got you. I want to be in this pool. I'm committed to helping you get schools reopened. Let's go. I'm blown away. That's a sign of Portland right there. I think that is something that we should all be taking great pride in. As of today, I have 15 who I've interviewed over the past couple of days and are in the pipeline. And I have about 10 more interviews scheduled tomorrow and next week. All of these individuals I've spoken with, they're wonderful people. I trust them. Some of them don't have a lot of experience with kids, but they're good people, and we can get them ready. They are now going through, because what I've done is I've referred them now to ESS. ESS is doing all of the onboarding in terms of payroll and background checks. So the only hurdle that we have at this point is we need to get their fingerprints, and we need to send their fingerprints to the FBI and DCF and state and have them cleared, make sure they're not felons or on any registries that they shouldn't be on. And if they are, we won't have them, but we need to background check them. That takes about 2 to 4 weeks. It's a longer process, as you can imagine. They need to background check them. So assuming that these people that have come forward I can get through this background check process, I will have the pool of subs that we need to open schools. But I need more time. So my recommendation to you tonight is that we stay remote until Friday, January 8th, which will give me the next 4 weeks and including the vacation. So the time in remote from away from in terms of teaching and learning is all next week, the 2 days before the holiday break, and then the week after the New Year's, and then we're in 2021, thank goodness, right? By then, I will have generated this pool, I'm hoping, and background checked and trained and have the people on call ready to come in and help us. So I'm guardedly optimistic, without any commitments tonight, that we reopen on Monday, January 11th, with the pool of individuals ready to go that I need ready to go.
You waiting for questions, Charles?
That's the recommendation. I'll pause there and entertain questions. Or
I'd like to start back with ESS. Did they give you any explanation why throughout the year they've been able to give us X amount of subs, but now they can supply 0? Why are we not getting any subs? People are afraid of the coming into the schools, or what? Is that the reason?
there's a couple answers to that. Getting substitute teachers in a normal year is difficult, right? It's not the most appealing position. It's difficult to fill in general. This year, don't forget, every school district is in the exact boat that we're in. Every school district is confronted with several factors. Not only is it the quarantine period that people face when they're subject to contact tracing. Don't forget, we're also saying to folks, if you don't feel well, this isn't the year to power through and go to work. Stay home if you're sick. And I'll remind everybody that we're accommodating 14 faculty who have come forward with doctor's notes and said they're high risk. And we did that by putting them in the PVLA, right, the online school, or in some cases doing this, we talked about it for the inverted distance learning, where a sub is in their classroom supervising the students, but the teacher's teaching from their home or other location. So that's 14, coverages that we need. In addition, this week I had 3 more teachers bring their doctor's notes forward, either because they have a new condition or an existing condition was exacerbated and are asking for this inverted assignment. And I have 16 teachers who are asking for that because their daycares or schools are remote and they have young children and are faced with short-term emergency childcare needs. So the drain on the sub pool here in Portland has literally dried up the sub pool here, partially because ESS doesn't only serve Portland, it serves other towns too. And everybody is in need of subs for all of the same reasons that we're experiencing here in Portland.
So Charles, I'm glad you mentioned that ESS serves other towns. Do we have any guarantee that this pool of folks that you're interviewing are going to be subbing only for Portland, or could they be shipped elsewhere and then we lose those folks that we've added to the pool?
I have been very clear with Beth Solaris, our ESS person, that the people I am sending to her are mine. And I am going to be making sure that happens. And I've put my bulldog, Meg Wright, on the case. And she is going to be collaborating with Beth to make sure that I haven't done the hard work for Beth and generated a pool for her that she's going to farm out anywhere but to us. And if that happens, we may not use ESS anymore.
Can I ask a quick question about the 16 staff members who you brought up who have been teaching remotely the last week and a half due to childcare issues? Are you suggesting that if we, because I'm curious, you're including those as staff members that we would need substitutes for? And so, okay.
I didn't think.
I just want to make sure I understand. If you listed that along with staff members that you know, the new teachers who have doctor's notes who, for whatever reason, will be teaching remotely. Moving forward, at whatever point we do return to in-person learning, whether that's January 11th or a different date, will those, you know, there may very well be teachers who continue to have childcare issues because different districts are making different decisions. Will those teachers be returning to teach in person, or are you continuing to try and accommodate childcare needs?
Excellent question. So those 16 people that at the beginning of our remote period asked me for the ability to work from home. Many of them, 9, I believe is the number, I'd have to go back and check, but it's either 9 or 10, are parents of Portland students. Their kids are at Valley View or Gildersleeve. So when Portland reopens, they're coming back, right? So of these 16, some are our people, right? And clearly their kids aren't at Valley View, they're home, and they need to be at home. And they've asked for it because I've said that we're not closed, we're open, and I'm still having faculty and staff come in. Even during this period of remote learning, they're remote learning from teaching from their classrooms. But your point is very well taken, that it's very likely that on January 11th, Portland will reopen, but East Hartford will go remote for 2 weeks because they get walloped the way we did 2 weeks ago. And that I'll have 3 teachers say to me, I have my kindergarten first graders home. I think it's 2 weeks because East Hartford is only committed to 2 weeks at a time. I need to teach remotely from there. What I need to be able to do is say, I've got this deep pool of substitutes. I'll put the substitute in your classroom to keep an eye on the students. You teach from home. And then of course they're teaching from home while managing the very challenging job of supervising and taking care of their own kids, but also teaching ours. But that's what we did all last spring, and what many of our teachers are doing now, is that very cumbersome task of trying to work from home while holding down the fort at home. But that is the reason why I need a deep pool of subs that are available at the drop of a hat, because who knows what every day is going to bring us as we go through this process.
Hey, Charles, how about we take a room and we hire one person to let those teachers bring their students into the school for the day, and we just kind of keep an eye on them. This way we're only expending one person versus 10 or 16.
I'd have to think that one through a little bit.
I will say that that some of the things that I've heard with not everybody has school age children who are going to school. Some of them have youngsters that are toddlers, and that has been a bit of a disruption in a couple of situations where the toddler took over the class, and that could be problematic going forward. I kind of like Dave's idea that we provide on-site daycare through the Y or through, you know, I guess you have to think about it, but they could bring their child to school and they could be in the classroom.
Honestly, it's the first time that the idea has been floated to me. It's not a bad one. Let me just kind of think it through logistically a little bit, but certainly I would say it would need to be a partnership with the Y.
Yes.
But, we've built a lot of things that we never thought we'd have to build this year. I couldn't see why putting together a in-house daycare for our faculty would be impossible. I certainly something I always want to run through the brain.
We also have other daycare providers. There are some organizations in Portland, and there are some home providers that might be willing to step up and take an extra kid or two as well. So that could be a possibility that we could look at.
Yeah, good idea.
I think we just have to get creative.
We have gotten creative this year. We can continue that for sure.
Yeah.
While we're talking about our partnership with the YMCA, if we're looking at another, you know, three-ish weeks of distance learning, in which families are scrambling to find childcare and paying potentially $50 per day per child. You know, if you have 2 or 3 kids and you're needing childcare, that adds up significantly. And our families, I mean, I've heard from so many families over the last 2 weeks who are under so much stress and strain anyways, and the financial strain of this decision on them is, you know, not something that that I think we can disregard. And so I want to know what we can do as a district to make this more affordable for families.
Look, I'm so glad you said that. That is, you are absolutely right. So what the YMCA does is they have their own scales that they use to prorate the tuition for the daycare. So I don't know their exact numbers, but if you make a healthy salary above their max, right, the cost is $50 a day. But then it's a sliding scale down to $17 a day, I think is the low end, right? $17.25 a day. What I've done is I have, and I will continue to email it out, put out a plea for donations. And I personally have made a nice donation to the YMCA. And I know others on my leadership team have, and I've asked for anybody who is on this call and hearing my voice, if you're looking for a charitable contribution to make as we're heading into the end of the year here, please, I will send out the information again or get in touch with me. And I have a contact for you. Her name is Amy Cardoza at the Middlesex YMCA. Make a nice donation there. I have already, and in my donation, I got a commitment from them that this will go to support Portland families. Anybody who does that will support Portland families, and they have their ability to identify families in need and further supplement that sliding scale that they already have in place.
Charles, even with the sliding scale, I mean, a family like mine, if we had 3 children, that would be $750 a week. We would not qualify for, I can guarantee you, we would not qualify for a reduction in cost. $750 a week would hurt us very much, and that's with making a healthy income. So I feel like is there a way that the district itself can help to subsidize childcare?
I don't think so.
How are we going to do this for families? It just $750 a week, $500 a week, and we're talking another 4 weeks. It could be thousands of dollars per family here.
Well, you need to consider the fact that at least 2 of those weeks were scheduled for break anyway.
Yeah.
So,
Sure, but we've already had 2 also. So we're talking 4 total weeks of childcare.
I mean, I'll look at our bylaws, but I don't think that that's part of our charge.
I think that Sharon is right about that. There may be some grant money or funding. I don't know if the early childhood, there was some COVID money given to daycare providers back in the summer when they opened for first responders. I started to look at it when I sent some things to Charles about daycare and some issues that we could, maybe look at. I could do a little research and see if there is any grant money left from the early childhood or from DCF or some place where there might be some grant money from COVID.
And I have a couple of suggestions. None of these are good, but I have a couple of suggestions. Let me start it by saying I don't think it would be possible or wise for us to use our LEA budget to pay for that. I don't think we could, and I think we would be in hot water in a lot of ways in inviting a problem.
Absolutely.
I can't get behind that.
Mhm.
I can get behind anybody who's hearing me give until it hurts. And if you know any philanthropic organizations, reach out to them and explain that you are absolutely right. This is crushing some of our families financially. The other place that we need to do is, and I know that here in Connecticut, in some cases, we may be preaching to the choir when we talk about elected representatives at the federal level, but that was the point of the stimulus checks that everybody got last year, and everybody needs them again.
Right.
That's my political chops showing, but Washington, hello, Americans are suffering. Help us.
So I completely understand what you're saying about the LEA budget. I'm curious about whether it would be feasible to spend any of the COVID relief money that we received from the state towards subsidizing childcare, or if that is kind of out of the scope of that money.
I think it's out of the scope of what the board is meant to do.
Yeah.
I mean, we have a very clear
mandate.
set of rules that we're supposed, I mean, we're here to
I
run
hear
the
I hear that,
district
Sharon.
schools.
But
So
also
I
we're
don't think that we could use any of our budget
okay.
to subsidize daycare. I don't think that we could do that.
Yeah.
Does it have
You
to
know,
be considered daycare? Could it be our own staff running something? Does it have to be
I
farmed out?
want to also
They're
point
teaching.
out, but I do want to point out that I have sent some of our building subs over to help get it going because the YMCA doesn't have the staff, right? So
I don't either. No, they don't.
yeah, so in order for the YMCA to get it going and to keep the groups small, right? So that we have small cohorts and not, 30 kids in one group. We did send over, we have full-time building substitute teachers that we did send over. So we are helping with that in order to keep it going. So we are doing something. I want to make sure that everybody knows that and that money, while it goes to ESS and ESS pays the subs, it is coming from the Portland taxpayers and, and otherwise those building subs would, be doing well, I mean, we would have them working remotely in some way, but we don't have a lot of need for substitute teachers when we're remote. But so we do have them and they actually appreciate it, right? That they have something from us that they can do. And we needed to do that. So we do have that. Those are the people, difficult enough, who are quarantined right now. So now they're not because they're quarantined, but for the first week of this, as we got it up and running very quickly, we did send them down to Gildersleeve to help out so that we could get it up and going. As of today, they're not because they're quarantined, but that's a separate issue.
The other thing I would point out in terms of people making donations to the YMCA, I would also suggest those that work for large corporations, a lot of times there's matching for charitable donations to the Y, the United Way, that type of thing. And maybe, people could reach out to their employers and see if they're willing to match any of the contributions that they're making to the Y to help support this.
And all you have to do, and I'll put the information out in an email again, but just get in touch with me and I will immediately put you in touch with the people at the Y. And the YMCA has it set up so simply. All you need is your credit card and 5 minutes of your time and however much you can give and click the box that says comments and just say in the comments, please make sure this is to support the Portland families. And they take care of all of the administrative work on it.
Charles, I did put it into the chat if we can share that with everybody, the address and Amy Cardoza, who's the contact person. So people can look at that again tonight.
For sure.
It's complicated and I just think we are all pulling together and the community is behind us, I hope. And hopefully on the recommendation of the meeting last week, December the 1st, when we talked about people reaching out to the school to ask for help, mental health, social, emotional health, trying to find resources for people that are struggling. I hope they'll continue to do that. And if you know of somebody who's struggling, let somebody in the district know. And we can, all work together to get through the next few weeks. I think it's going to be a challenge beyond anything we've ever, seen in our lives.
Charles, can you talk about your recommendation for January 11th versus January 4th?
So
yeah, I'm thinking you initially said you needed that 2 to 3 week window to have everybody federally background checked and all of that. And I'm just curious about why you're pushing it back to the 11th.
So it takes about 4 weeks at the outside to get a background check.
Okay. Sorry, I thought I heard 2 to 3. Okay.
It's 2 to 4, but it also, and this is something from our experience, slows down considerably over the Christmas, New Year's time. FBI agents are also taking breaks, or whomever it is that does those checks. So I think that we're going to be pushing it by January 8th, but that's 4 weeks from now. And I've got, like I said, 15 people in the pipeline right now. But the process, just so you're aware, and anybody who's curious about it, is they go to ESS, literally they have to take a card down to the Portland Police Department, get their fingerprints on it, return the card, and then the card needs to go into the background check system. So between getting the card, getting the fingerprints done, whenever hours are available for that, having the background check done, I am hopeful that January 8th is enough time, but I think that would be barely enough time if we get lucky.
Are we paying for the fingerprinting, or are they having to pay for it themselves?
So that's a really interesting question. What I've said is a lot of these folks are coming forward not because they're looking to make money. They would volunteer to do this. I've said let's do this through the sub route to begin with. So we're going to pay for, it's $88 the background checks if the person is willing and able to make a longer term commitment. We're not, how do I say it this way? A lot of the people who have raised their hands are college students, Portland High School graduates who are home for a short period of time, generally January 18th or so, before they have to go back to school. We're not going to pay for them because they might only be available to us for 2 weeks before they go back to school.
Right.
If they say to me, I'm willing to commit to help you out for 3 months, then we'll help you with the $88 to get you going through the process. But if it's only 2 weeks, there's not a lot of cost benefit there. It's,
Right.
That makes sense.
And the other thing that I'd heard was that CABE and I think the Department of Education is looking at people who hold certifications who are not in the teaching profession, who may be unemployed right now. So I think that a lot of effort is being put into locating people that would be qualified to teach that maybe are not teaching and maybe could use the work. So that's another resource that is being looked at. Whether it produces anything, I don't know. But there are a lot of people who went to school and got their certification. They keep them active, they just don't teach. So that may be another resource.
Any other questions?
No.
Dave?
So then I'll just leave you with one thought. I'm going to continue next week, and then of course the 2 days before the break, and then over the break, our leadership team, they work 24/7, 365. Although I'm certainly hoping they'll take a couple days to catch their breath over the break.
I do too.
I want everyone to know, and anybody on this call to know that our priority first is Valley View, Gildersleeve, and Brownstone. That's where we need to get going January 11th. So as we build this subpool, if it's only half what I expect it will be, that's also going to inform our decisions about the models that we come back in. But at this point, I want everybody on this call and everybody here, I hope you'll agree that K-6 goes first. They have to come back first. We've got to get our youngest learners back in the classroom for the childcare that it provides our families. Even though we're not a babysitting service, let's be honest with each other. Our families need our kids in school, and otherwise they can't work. And as we know, our youngest learners, for our high school kids, this works. This is okay. The distance learning, it can still happen. It's not as good or preferred, but for our youngest learners, my goodness, we need them back in the classroom. And really I'm going full bore for that January 11th. That's got to be our commitment to get our youngest learners back in the classroom. So I'm really just asking the community for the additional 2 weeks and 2 days, only because I need that time to stand up a pool of adults willing and able to fill in when the inevitable happens, if the curve doesn't flatten by then. But I think we need to actively communicate that January 11th, Valley View, Gildersleeve, Brownstone are going first, and we'll figure out what we need to do with the middle school and high school, and they may look different. It may mean K-6 is full open, middle school and high school or hybrid or some form of remote. We're gonna get creative and think about that, but we need to understand the challenges for our youngest learners and get behind prioritizing those schools first.
Charles, I'm so glad to hear you say that. I'm also wondering about the kids that are currently being serviced in schools, the IEP children and the highly, the special needs kids.
I can tell you about that. Dawn is on, I think Dawn is on the line. She could chime in. If our sound booth could unmute Dawn. We do have quite a good number. I think that number is 57 students coming in for various parts of the day. So I want to get the attention of our technicians, and if we can unmute Dawn Davis. I think she's on here. There she is. Hi, Dawn.
Hi, good evening, everybody.
Hi, Dawn.
You guys hear me okay?
Sure can.
Sure. So thanks. That was a great question. We have a really dedicated group of people, from bus drivers to secretaries, teachers, paraeducators, related services people, that are just doing this phenomenal job right now. As of our current counts, we're even up more than what I spoke to you about at last week's board meeting. We're at 72 students coming in for some services. Most kids are coming in for 2-hour blocks. Remember what I said 2 weeks ago. This is coming in for IEP services, reading instruction for those kids that are in the survey process, or not making progress in reading and mathematics. So there's 18 kids coming into Valley View, and that includes our pre-K and our ABA lab. There's 7 kids coming to Gildersleeve, and Gildersleeve may grow a few more, especially depending on how things go tonight. There's 14 children coming into Brownstone, and that includes children coming into the new bridge program. 19 at the middle school, which is great. And we think of, we had said earlier, I think Charles said about the focus being on the elementary school, but there's a core set of students at the middle school level that are just not being as successful as we'd like doing the distance learning. So they're coming in for either a morning session or an afternoon session. And then there's 16 kids coming into the high school, and that includes kids coming into our life skills program, as well as our collaborative learning program for students with social emotional needs. So it's a good group of kids.
So if, hopefully we fully reopen on January 11th, if we're unable to, say, reopen the high school, middle school, would those 14, 16 life skills students and other students in the middle school be able to still come to school as they are now?
Yeah, as long as everything stays as it is right now, and we're not worried, it's more of an issue of staffing versus an issue of transmission. By all means, we have the staff and the capability to bring people in.
Thank you.
And the transportation.
And the transportation, yes. Our transportation specialists from M&J have been working closely with Nancy, my administrative assistant, to have it be consistent and have everybody get to where they need to get to. Any other questions for me? All right.
No, stay
you.
well.
Thank you.
Thanks, Dawn.
Thank you. We're working on it.
As in the past, do you want a resolution from the board or a motion to support?
I think that's important.
I do too.
In my mind, I think it is important that we're seen as a team, that you're having all of your questions answered, and symbolically and practically it is important, and also because it is the Board of Education, even though the state has said it's the superintendent's decision. It is the Board of Education who assumes the liability for a lot of this, right? I mean, so you need to be aware of that, and the votes, have standing, have merit. They mean something when you say we're behind this. And I do want you to know that if you vote not to support this, it would get me definitely rethinking the decision. I want you to know that. I mean, I'm put in a very difficult spot this year where I'm told that, Charles, it's the superintendent's decision, but if the Board of Education doesn't vote to support the superintendent's decision, trust me, I'm calling the reopening committee together tomorrow morning and having another very hard conversation with them about what this community wants. Before you vote, I do want you to know that this decision that I'm sharing with you tonight was unanimously endorsed by the building representatives at each of the schools who I meet with, unanimously endorsed by the reopening committee, and unanimously endorsed by the district's leadership team, all of whom I met with at length this week. So I do think it's important, and I would like that to happen, and know that if you said no, Charles, we don't support that recommendation, that's what it would be. And I would just like to hear what you would like to see. And while it may not be what we would do, I would undoubtedly tomorrow be calling a reopening committee meeting and revisiting the recommendation I just made to you, which is just to reiterate, stay in remote until January 8th, work aggressively to develop a deep pool of substitutes, and then assertively work to reopen fully Valley View, Gildersleeve, and Brownstone on January 11th. And within that, we need to reconsider a little bit more the middle school and high school, because the conditions at those two schools are just qualitatively different and merit potentially a different model than what we would look at Valley View, Gildersleeve, and Brownstone, as a function of our ability to cohort, which is very different, especially at the high school.
No, isn't the middle school cohorted in the same way as the elementaries, though?
It is cohorted, but it's not cohorted in the same way because all of the teachers travel to all of the classrooms.
Okay.
In K6, one teacher stays. Well, actually, Brownstone teachers travel a little bit.
Right. Less though.
Middle school,
right.
they travel a lot. Valley View and Gildersleeve, they do not travel except for the specials teachers.
Mm-hmm.
So that's what makes that more complicated, because again, if we're in that contact tracing place with the 6 feet, 15 minutes, it could possibly be that, 6 or 7 teachers at the middle school would be subject to quarantine, where K4 it would potentially be the para, the teacher, and the specials teacher, which is fewer. That wasn't very articulate, but I hope you got that.
Getting late.
Well, I think everybody should weigh in. I would suggest that the motion be worded in a way that suggests that we develop a pool of qualified substitutes, and that we develop a plan to prioritize our K6 students and special needs students on January 11th. Am I leaving anything out? But I think everybody should weigh in. I'm for it, and it breaks my heart because I spent a lot of years teaching, and I know that kids belong in school, and I know that parents need to work, and this is a challenging time, but I think we'll get through it if we all work together and we all breathe, do that mindfulness breathing, and I think we'll be okay.
Lauren?
Yeah, I mean, I feel the same way. It's so sad, and also sounds like absolutely the necessary thing to do. I want my own children in school. I want all the children in school, and I want kids all the way from pre-K through 12th grade in school. It's where they belong, and we're hearing how safe it is. And I just hope that people will commit to becoming substitute teachers and will help us out, and that we'll be able to fully reopen in January. Yeah, but I support. Yep.
How about you, Mr. Darby?
Yeah, I've no to add here. I mean, the whole thing shows. I don't know. It's frustrating. Hybrid. We were just talking today at my school. Hybrid is the worst of both possible worlds.
It is.
It's terrible for students and families. Obviously, just from personal experience, it's difficult as a teacher to teach in this situation, and just reading the emails and talking to folks around town about the childcare, it breaks my heart. It's terrible, and I don't know. It's frustrating for me, I would say, because right now, watching complete sort of lack of conviction and lack of any kind of meaningful action at the federal level is just ridiculous. This right now, you know what? Well, I don't want to get too partisan, but you know, at this point, we're pretty much waiting because some people think that corporations need to have, you know, free reign to not get sued, and that's what's holding it up right now. And it's just absolutely ridiculous that something as basic as childcare and healthcare has become politicized. It's terrible, but I mean, 100% I support what you're doing. I feel so bad for the families, talking to people around town and reading the emails, but it's like our hands are tied, you know. And I think I really appreciate that you said, Charles, that, you know, I think we're hopefully we're hitting the low point and things are going to start to get better. I feel like there's a lot of positive things that are going to start to happen. So yeah, let's see if we can pull together as a community and make the best out of this.
Laurel?
Yeah, I mean, I would fully agree with what Meg and Lauren and Chris have all said. And if you're telling us that we don't have the ability to staff our schools, then of course I will completely support you in this decision, and just want to additionally publicly acknowledge, I mean, we all know how challenging this is, especially for parents and families of our elementary school age children, and how challenging this is for our elementary school students. As the parent of a kindergartner sitting next to her all day while she's staring at a screen, it's, you know, it's not how a kindergartner is meant to be learning. And it is so hard as a parent to watch that. And it's hard to be thinking about all of our students across the district who, you know, are having this as their experience this year, but it's where we're at. And like Chris said, our hands are kind of tied. So let's put all that effort towards getting adequate substitute coverage so that we can get kids back in school.
And I'll just echo one other thing. You mentioned doing the donation to the Y, super quick and easy. I got an acknowledgement right away, and they need the help and they're very grateful.
Yeah.
Thank you.
Dave?
Yeah, I agree as well. I mean, I'm also concerned because I think we maybe need to start thinking even of a plan B for January, because, and I don't know the exact numbers, but I'm trying to keep track of it. It seems like the number of teachers that are out seems to be increasing. And that could be due to the fact that the numbers are increasing. And if we think we're gonna get 2 or 3 more weeks of bad numbers or worse numbers, could we see even more teachers want to be out, and we're not gonna be able to even have enough in January. So it's kind of a catch-22, you know, you want the kids back in school, but then the teachers don't want to come back in school. So, I mean, I don't know what the answer is. I'd like to really understand why the teachers don't. I mean, is there something in the school system that we're not doing that could protect them more? I mean, is there some plexiglass that we could be using? Is there some face shields that we could be providing? Is there something that make them feel safer, that they'd want to come back into school? Because the number seems to be growing.
I don't know that it's a question of they're not feeling safe. I think some of them have underlying conditions that make them more susceptible. And
Yeah.
I don't know if that's basically, you're saying the same thing and I'm just not hearing it the same way, but I don't know.
Yeah,
What do you
Dave,
think, Charles?
let me answer that specifically. The teachers who I was talking about presented medical documentation. You know, look, we in any organization, you have teachers who are fighting cancer, or, you know, kidney transplant survivors, or medically fragile people. And what we've done here in Portland, we've committed that if you provide the medical documentation that says you're in this high risk category, where if you know, if I get COVID, I hope I don't, but I'm also hoping that I would get sick for a couple of days, like most people who are getting it, and bounce back, or maybe not have any symptoms. But what we know is that people who are sick that get this are you know, likely to have a serious bout up to fatal, right? So those people who have provided medical documentation from a medical provider that say, my patient, your teacher it is too dangerous for them to be in school because they would be, you know, potentially losing their life if they had COVID or contracted COVID, whether it's in schools or anywhere else. Those are the teachers who we've accommodated. Those numbers aren't growing. Those numbers are pretty stable now. we did have 3 more teachers this past week who did come forward because they have new conditions, right? I mean, people find out they're sick at different times of their life, and unfortunately, these individuals have found out that they're sick or knew they had a condition that's gotten worse, and their doctors have said, hey, look, I'm worried for you if you're not sheltering in place until this is over or there's a vaccine. That's the group I'm talking about primarily, who we're supporting. The other group is the one you talked about with the daycare, and I think we could look into that. Those are the people that are short-term impacted when, you know, the Little Bears daycare closes for 2 weeks because their faculty's quarantined, and then they're, you know, in a position where for the next 2 weeks their kids don't have anywhere to go. You know, and lots of our teachers, of course, have grandparents or parents or neighbors that can watch them, but some don't, right? So really, those are the 2 groups I'm talking about. It's not a large number in the overall faculty. It's, you know, 3 to 5%, but it isn't growing because of anything we're doing in terms of masking or plexiglass or anything like that.
Okay, it just seemed like the number was growing. I just thought maybe more people were getting nervous. And
Yeah, it's not about nervousness. It's about, you know, medical conditions.
I think it's also the quarantining has contributed to making those numbers higher. Dave, you have to, you know, kind of consider that as well. If someone tests positive, you do the contact tracing. We have a lot of people who have had to quarantine for periods of time, which can also affect our need for the subs.
yeah, right now,
And they could be
we've been
I'm sorry,
remote
they could
for a
be
couple of weeks. We should be clear of all the quarantining. School related, I would assume.
well, school related, but I mean, if my husband contracted it at work, I would still need to quarantine. So I think that's something that sometimes people, when I'm speaking with members of the community, that they're forgetting, is that these cases don't necessarily have to have come from a school quarantine.
They're not
We're having
coming.
to quarantine all the time.
Yeah, I could give you those numbers. I would say that the majority, 50.6%, slim majority, but majority of adults who have had to quarantine are often, you know, they were at an event or interacted with somebody outside of school and are quarantining because of that too. It's not only they're being exposed in school, you know, they're being exposed anywhere. Lots of our teachers have second jobs and it's happening there, or the big one, the huge one, is their own children are coming home positive and then they're quarantining. And an enormous wave we got knocked around with was when the college kids came home and, you know, they're staying in mom's house again and they tested positive. So it's everywhere. It's not just exposure in school. It could be exposure anywhere else that, you know, these teachers are living or doing things.
And just a reminder that we're coming into another holiday season. I mean, we know that people traveled over the Thanksgiving holiday, they got together with family. And so we're seeing that rise in infection rate, which they think is this week or next week. And we're going to go into Christmas and New Year's and people are going to go out again and they're going to gather. And, you know, the recommendation is stay home. If you're in a house, wear a mask, even with people that you know. I don't know how many people are doing it, but, you know, we can keep our fingers crossed that the infection rate goes down, but January 11th is a long way away and there's a lot of holiday stuff in between. So I don't know. You know, we can just keep our fingers crossed, remind people to stay home.
Lauren, did you want to add anything?
No, no, I don't think so. I just feel really horribly for families that are so heavily impacted by this, but I really feel like it just is what we need to do.
Yeah, I don't know that we really have a choice.
No,
if we don't have staff, we don't have staff. And like I said, I don't think we have a choice, but certainly I would also encourage everyone or anyone who's able to assist in whatever way possible. And that can be making financial donations, or it can be, as Meg indicated, following the guidelines that we have. Stay home, wear a mask, wear gloves, wash your hands, and sacrifice. If, you know, that's what we all have to do in order to get through this and stop the spread. So hopefully that'll be in the back of people's minds when they think about wanting to have their kids in school. that they have to
And I
sacrifice.
just add, and
you
if
know?
anybody wants to come in and sub, give me a call. Yes, you're welcome to come in and substitute teach. Love to have you.
Okay.
So, was there
So
a
the
motion made?
Well, I kind of started to word it to reopen on January 11th to achieve or develop a qualified pool of substitute teachers and to develop a plan to prioritize our K-6 students to be the first, to prioritize would be the first back to school in January. Does that cover pretty much what? Okay, so that would be the motion that I would make.
Oh, I
Are we
think,
saying
well, we
this
need
is
to
a
start. Sorry, Lauren, I think.
I'm sorry, is
we
this a
have to-
guarantee that we're doing this, or are we saying, you know, fingers crossed, we'll be doing this on January 11th?
I think that, well, that's kind of what I was gonna say too. We have to, the motion has to start that we're gonna support Charles's recommendation that we remain
Right.
remote until
I would say
at
until
least,
remain remote until January 8th in order to provide the district time to develop a pool of substitutes.
Okay, develop a pool of substitutes. All right. And do you want to
And then if you
also add?
wanted to- If you wanted to add, and then of course, in considering reopening, prioritize K-6, I think that would be fine too.
Okay, in consideration of opening, okay, all right, done. So I
okay.
made a motion, yep.
I'll second
So
that.
second. Laurel,
Yep.
Laurel, second. Any other discussion? All in favor?
I,
Bye.
It is unanimous.
Thank you. And the nice thing is I don't think we need another special meeting. We have our January, gosh, I gotta look at my calendar. We have a meeting in January, so I can, that first
January
week.
5th?
Yep.
January 5th. I will be able to update you on January 5th of where we are. So we don't need a special meeting, and otherwise I won't see you all until, thank God, this year 2020 is over. Oh, man.
I think there's gonna be a primal scream on New Year's Eve, and we're all gonna make sure this year goes away,
Get rid of this awful
Yeah.
year.
honestly.
Oh, man.
Okay, is there a motion to adjourn?
Come on, somebody.
I'll
Motion
make
to adjourn.
There you go.
Laurel, second by Lauren.
There you go.
All in
8:08.
favor?
Aye.
Bye.
Unanimous.
All right.
Have a
Thank
happy
you.
holiday.
holiday.
Happy New Year,
Everybody
everyone.
stay safe and healthy and wear your masks, please.
Yep.
Stay safe,
Yeah.
everyone.
Yep.
Good night, everybody.
Good night. Thank you. All right, where am I here?